This patient is a young boy who underwent endoscopic resection of a right-sided growing subependymal giant cell astrocytoma. This is the initial view of the tumor in the right lateral ventricle. We are coagulating with the endoscopic bipolar the surface of the tumor. You can see the choroid plexus deep to the tumor. The ventricles are not large here, so we're working within a small space. This is the grasping forceps, which rotates and then resects the tissue after it has been coagulated. You can see the vascular nature of the tumor, moderately vascular. So as we work and remove this in a piecemeal fashion endoscopically, we remove and then further bipolar, which shrinks the tumor and devascularizes it. Here we're using the forceps once again to remove portions of the tumor, which are sent to pathology and to tumor bank. You can begin to see the normal intraventricular anatomy with the septal vein deep to the resection cavity. All of the bleeding is dealt with by continuous irrigation, which washes out of the head. Here we are bipolaring once again. You can see the attachment to the choroid plexus here on the bottom left, and we are coagulating the attachment there and further removing it. This is aspirating the tumor using a pediatric feeding tube, which is placed over the tumor to aspirate it directly, and then removing additional portions with the grasping forceps. So this is done in a piecemeal fashion, gradually exposing the normal intraventricular anatomy. You can see the septal vein once again on the left side and the normal ependymal wall. Now we're working along the lateral side, the right lateral side, where you see the attachment at the caudate, which is relatively vascular, and a stepwise approach here, combination of piecemeal removal and bipolar. Once again, removing portions of the tumor in this location. And you can see the consistency of the tumor, pink, fleshy, relatively vascular. Very classic for a subependymal giant cell astrocytoma. Once again, this is the last attachment at the caudate nucleus, relatively vascular, requires a lot of bipolar cautery. And you can see here the end result. The foramen of Monroe, the choroid plexus, the thalamostriate vein, and the resection bed here, which was coagulated extensively. And this is the postoperative MRI showing a complete resection of this right-sided subependymal giant cell astrocytoma.